The Yorkshire Quality and Safety Research Group is a multidisciplinary group based at the Bradford Institute for Health Research, and we do research that makes healthcare safer. Today is a PhD Showcase event. We're here because PhD students are the future of patient safety research.
We work with our students to design research that's going to actually answer a real research problem within the health and social care sector, to work collaboratively with patients, members of the public and clinicians to answer those questions and create real change within the health and social care sector.
A little bit of background. So we know that the care transition can be a really challenging time for service users. My PhD project is looking at improving and understanding safety for service users who are at the care transition from inpatient acute mental health care to community settings. I wanted to undertake a PhD for many reasons. I absolutely love research and I've always been really interested in research. But I always also have quite a massive interest in health, specifically mental health. It's definitely a long-term career path for me.
The first part of the PhD was looking at a systematic review. It was the opportunity to take that time out from clinical practice and really explore in much more detail what it is that I could do to make that impact. So my PhD is all about older people across the hospital to home transition, but specifically looking at how they manage their medication across that period of time.
My PhD project is on de-implementing low-value care in mental health services. So ultimately it's about improving outcomes for service users or patients, not exposing them to care that's unnecessary or potentially harmful, but also it's about not wasting limited resources in healthcare services.
My PhD project is looking at how socio-demographic factors in older adults can affect the risk and prevalence of having an adverse drug event. It's really important in terms of how care is delivered, just so then we can tailor treatment for older adults and we can provide the support for those individuals that need so to deliver more equitable healthcare.
The support that I've got from YQSR and the Patient Safety Research Collaboration has been massive. I think I was talking earlier about how collaborative the groups are and how much you learn from so many different researchers and different topics in the group. And also the amount of opportunities that you get in the group. Things like I've helped to sort of plan conferences and presentations, attended events that I wouldn't normally have been able to attend. So yeah, the opportunities there have been great.
I benefited from them massively. So one of my supervisors works in the PSRC, but also from access through the Wolfson Centre that's based at Bradford Teaching Hospital Trust. The training that they put on, so there's often sessions that are either virtual or face-to-face, and I often try and attend that training where I can to improve the method options that I've got and understanding how other people have done their projects. So it's been really, really helpful.
They're just such a lovely group and you can always feel that you can contact anyone and you would receive some sort of reply back quite quickly.
The advice I'd give other PhD students is to really connect and network with other people, whether that's PhD students or other researchers.
I think part of a PhD journey is actually building your own skills and sort of working on improving your own knowledge and capabilities.
Be patient, realise that things will not always be in your control and that's okay. You will plan and you'll have Gantt charts for the whole period of your PhD and most of it will not align as to where you thought you were, but that's fine. And enjoy it. Really, it's such a privilege to be able to spend time on research that you are really interested in.
Following on from my PhD, I would love to be able to see that there is some sort of tool or perhaps some sort of intervention that we can really individualise treatment plans for older adults, and we can start really listening in to all the different complexities they have in their life and tailor the treatment plan to what is perfect for them.